this Memorial Day weekend here, we've got a new report shedding some light on the impact of the war on our Arizona veterans. A study done by the St. Luke Health Initiative finds our recently returning veterans have a higher chance of suffering from mental health issues than ever before. Joining me now is Kim Van Pelt with St. Luke's, and then Paula Pedine over here with the Veterans Administration. And this is something that we're not seeing the numbers going the other direction. They're actually increasing, isn't it?
Well, what we're seeing right now is, according to the Arizona Health Survey, a survey of 8,200 adults in Arizona, that right now people who have returned from Iraq or Afghanistan are about twice as likely to suffer from some type of mental health illness than other veterans or non-veterans. And so we're concerned about that, just because those are folks who essentially need services.
Is this something that spouses, family members can recognize right away, or is this something that comes on a couple months later, or 6 months later, or as they try to adapt back to, you know, the kind of society that we live in?
Well, part of the problem is they've had multiple deployments, which is something we've never had in any conflict before. So when they're going back there 3, 4, and 5 times and seeing the rigors of war, it's not a pretty picture. So what we're trying to do, and VA was early on in realizing this, years ago we established extra mental health counseling services for them. We have a walk-in clinic. They can come in any time. We have family counseling. We have a crisis hotline number that veterans and their family or friends can call if they see someone in need. I think the thing is recognizing that the need is still there. It's been there since 9/11, and we've had this rigorous war, and getting them in for services.
And these are the numbers that you can call for help. But if you are a spouse, what are some very early indications that they should reach out and get some help?
A lot of times if they have nightmares, if they withdrawing from their family, from their friends, if they're drinking too much, if they find that they're using drugs, those are not good coping skills. They help them for a little bit of time, but in the long run, they're hurting themselves, and they're putting it in the back of their mind. We have programs now that help them deal with it head on through recording sessions called prolonged exposure therapy, through journaling sessions called cognitive processing therapy, through a rehabilitation program that's a residential treatment program. We have all kinds of programs that are there to help them. If they need one-on-one counseling, group counseling, family counseling, VA is there to help wrap our arms around these young vets and help them.
Do you recommend, if somebody is having these issues, to get in there quickly before it escalates? Because I'm assuming that in time it would just get worse if you don't have a place to turn for help.
The sooner you intervene, the better. Some people think that they'll be able to handle it. Yeah,
and it goes away or something.
And it doesn't, Ryan. We all know that. Their study shows that the problem's still there, which is important. But the fact is, we've got to intervene. We've got to help these folks, and we have to remove the mental health stigma. There's a stigma about getting mental health therapy, and we have to remove that. Help is help. Healthcare is healthcare, whether it be for your mental health, for your physical health, for emotional health, and we're here to serve.
In the study, did they find anything about if it was just the one deployment or 2 deployments or 3, that more of the soldiers are coming home with these mental health issues?
Yeah, we didn't look at the number of deployments, but we did look at the differences between veterans who have served in Iraq and Afghanistan versus other veterans. And you definitely do see a big difference between those who've served recently versus those who've served previously. And part of that may actually be just better awareness and better diagnosis of some of these mental health issues. But we also saw concerns, for example, about the rate of binge drinking among these returning veterans that we're also very concerned about. So again, there are lots of services that are available. The important question is whether the folks are getting those services or not, and removing some of the stigma.
Is it harder for people to get the services when they come home to nobody, when they're by themselves? Because we go out there a lot of times when the soldiers come back and they've got the families, you have these great reunions, and a lot of it's what you see, but there's a lot of soldiers that come home and they don't have anybody. Are those the ones that you really have to pay attention to and go, I need to reach out even though I don't know them that well.
That's a good group to focus on, and what we find in that group is that their friends are the ones that help them.
Okay.
That's why we want the friends to feel free to call that crisis hotline number if they need that intervention. Bring them down to the VA for their health care. The thing is, you know, these veterans are eligible for free VA health care for a great amount of time because of the volunteerism that they've given to defend our freedoms. So we just need to bring them in and get them the help they need and intervene quickly. The sooner we get to them, the better it is, because the longer they're withdrawn, the harder it is.
All right, thank you very much for coming on the show here.
Thank
You know, we're going to keep that number up on our website too, so you don't have to grab a pen or paper and try to jot it down. Just go to our website at azfamily.com. We'll have the phone number up there as well. Thanks again for coming on here.
Thank you.
This
Thank
Memorial
you.
Day weekend.
Thank you.